So it is my pleasure to welcome you to this webinar series of the SOPHEA project. My name is Eva Maria. I'm responsible for the SOPHEA project, working together with wonderful people in Europe and in East Africa. And it is my pleasure to welcome Sabine Baunach, who you can see next to me. She's been crucial for the SOPHEA project, and she will facilitate this session and the entire webinar series. It's the second time today. And Sabine, I hand over to you.
Thanks so much, Eva Maria. Thanks and welcome, everyone. So I think last week we already had a really great start. I enjoyed it a lot. We dived into the webinar series and sort of set the foundation with great presentation from our guest speakers. We looked at the concept of the planetary boundaries. We reflected on implications of the climate crisis to key sectors in Africa, our focal area or region, and also looked into economics and the donut economy. And with that session, we really started to explore opportunities for a safe and just corridor for living. And that's exactly the intention of this webinar series. So for those of you who haven't been able to join last week, the recording is available on the SOPHEA website, so you can watch and listen to it again. And today we will take that knowledge and transfer it to a critical sector, the health sector, and continue to explore this corridor further. And I think this couldn't be more timely, because just a few days, if not 1-2 weeks ago, we saw at the annual World Health Assembly the adoption of the resolution on climate change and health. So I think this webinar is very timely, and together we can dive into health and climate change a bit more. So we will hear several presentations. We will hear 2 presentations outlining the health consequences if we're leaving the safe corridor of life, these planetary boundaries. And in the second part, we will hear from our speakers how living within these boundaries is possible, and even more, how it can provide opportunities for well-being. So this is very hope-giving, instead of just reflecting on the negative consequences over and over again. I think it's very important to identify opportunities and visions. So I'm very happy to welcome our speakers today. With us are Elias Nyanza. We also have Jennifer Cole, Oskar Masztalerz, and not yet in the panel, but I hope he will be able to join us soon, is Hashim Hounkpatin. Those will be our 4 presenters of the day. So before we will go into the first session, just a few ground rules. We will hear 4 presentations, followed by a panel discussion at the very end. There will be a 5-minute break in between, just for you to stretch your legs a little bit. This is always helpful. During the presentations, you're welcome to type any question or comment into the Q&A window. And both Eva Maria and myself will keep an eye on it, and our speakers will try to reply either directly, or we will park it for the moment and take it to the panel discussion at the very end. So without further ado, I am happy to introduce Dr. Elias Nyanza. Hi, Elias. Great to have you with us. Elias is a population and public health specialist working on planetary health in Tanzania. Through research and community interventions, he focuses on the reduction of harmful environmental exposures that affect marginalized populations. So Elias is holding several hats, several functions, but one of many is that he's a SOPHEA project coordinator in Tanzania. So Elias, great to have you with us today in this session. You're welcome to share your slides and start the presentation.
Thank you so much, Sabine, and the rest of the team, and welcome everyone to today's session. And my presentation is focusing on unveiling urban contaminants. And actually here we are looking on ecological approaches that can be used in the remediation of antimicrobial in urban, but also in rural receiving waters and wastewaters. So we are presenting an experience from Tanzania. It's important to note that whichever that we consume or release to the environment, at the end of the day, it comes back to ourselves. So to tend to familiarize with the antimicrobial that we are talking here, this actually will refer to substances that inhibit the growth of microorganisms or kill them outright. And it can be used in agriculture, in the human medicine, but at the end of the day, we have a lot of waste that goes into the environment. And at the end, actually, it comes back in terms of bioaccumulation and biomagnification. So it includes antivirals, antibacterials, but also antibiotics, antifungals, among others. So they are all actually, if they do not respond to a specific treatment that you are doing, then we end up calling them as a antimicrobial resistance. And this now is becoming actually a global challenge. And if we do not protect our environment, that means our environment in the future, we are harming it, but it will be harming us in one way or another. So if you look on this particular diagram, it's complex, but it's showing the entire paradigm in terms of whatever we use in the treatment, in the pharmaceutical industry, in the agricultural industry, in the environmental protection. And if we do not dispose it properly, it goes back into human being, it goes back into animals. And at the end of the day, if whichever that we take as food, whichever we take as resources to eat and so forth, it comes back, affect the ecology, but in the near future affects ourselves. So you can see that the global production of antibiotics actually is around 200 tons, and actually most of it is released into the environment, and at the end of the day, actually we end up consuming it and affecting our health well-being. So you can see, for instance, in Africa, if you talk about the antimicrobial resistance, so it's happening in most of the countries significantly. So affecting animals, affecting plants, but also if we look in terms of sediments, so we have done a number of studies in the country, but also in different parts of Africa, showing how much the contamination is to animals, to plants, to soil. That means whichever that we are growing into our environment is actually taking this antimicrobial residues, and it comes into human being as food. So you can see here, if you consume fish, for instance, if you look, for instance, in Tanzania, in Kenya, in Sudan, so a lot of contamination is happening there. So if we look again in terms of meat and milk, so you can see in South Africa, in Djibouti, in Egypt, the number of food that is consumed actually is contaminated with antibiotics. So the antimicrobial resistance now, we understand is a natural process happening, but the way how it's happening now at a speed that we cannot control. And there is a need actually to address in a different way now. Instead of only doing health promotion in terms of minimizing misuse, overuse, over-counter medication, but we need to ecologically, innovatively come up with interventions that actually will slow down the generation of the antimicrobial resistance, especially in low and middle income countries. So you can see in clinical setting, for instance, there is a lot of misuse, and they already overwhelmed the health facilities in Africa, and then encompassing with increased non-response to medication associated with antimicrobial resistance is ending up affecting a larger population in terms of the disability adjusted to life years. So a number of people are hospitalized, but there is no cure because the medication that's supposed to treat is not working, but what is working now is more expensive than how one would afford. So you can see, for instance, in Tanzania, in 2019, only more than 12,000 people actually died because of the antimicrobial resistance. That means they were at the hospital on time, but the hospital could not provide the medication for that specific disease. So what are we suggesting now? We have come with what we call a biopolar adsorption. These are ecological, they are plant-based, And the biopolar material are biomass-based material delivered from renewable resources. And you can get it from plants and treat them and use it at the waste stabilization ponds. So before you release the effluent coming from hospitals, from pharmaceutical industry, from home and whatever, that is treated through this ecologically friendly material and absorb the antibiotic residues. So once you absorb, that means whichever that is going into the environment is minimal in terms of hazardous. So if we look, for instance, in terms of the testing, so we wanted first to know what do we have in the environment. So we found actually that most of the antibiotics that are dispensed at the facilities, at the health facilities, are actually into the environment. So we found, okay, fine, let us start with one after another. So using evidence from elsewhere, from other countries, so we were able to do the examination of the wastewater, of the soil, and some of the plants actually, to see what is existing within the environment itself. So this is the one of the biopolar material. This is the geranium seeds. So geranium seeds are edible, so you can harvest, extract the juice. That's one of the economical benefits. But then that means in Planetary Health, you encourage more planting of the geranium plants. So that means you are conserving the environment by planting more trees, which are beneficial to the population because they get food out of that, the juice. But the seeds now here is what we are interested in here. So this seed here is dried and pulverized to get the powder. Then the powder here is calcinated at a temperature of 400. And once this one is calcinated now, this now becomes what we call the biopolar material. So we're talking about the geranium seed as the biopolar material, which actually ends up absorbing at different pH and different temperature. So what you are supposed to add now here, that different antibiotics are absorbed at a different pH. And that was a big challenge. So you have to have a series of waste stabilization ponds immediately after the filtration. So in this specific case, for instance, some of the antibiotics are absorbed very well at a pH of 0, but some actually at a pH of 13. So that means you have a first cereal pond at 0 pH, and then the next one at 13 pH. That means you can absorb most of the antibiotics residues that are coming from the waste or from the water that is received from the health facility, pharmaceutical industry, from home residency, among others. So you can see, for instance, we customize it for flaxseed, but also from the lamivudine. So at the end of the day, what we want actually here is protect the human being. That means they have water for irrigation, which is safe from antibiotic residues. We have water that is used for human consumption, that is free from antibiotic residues. In that way, actually, you are having healthier environment, but also healthier people that are consuming something which is not toxic, or that's something that will not harm them in the future. So I have already mentioned about the prevalence of different antibiotics residues in the environment, but you also went further to look on what kind of microbes that are available but cannot be treated, that are developing resistance in this particular environment. So you can see from here a number of them were documented, and it's not my intention to overemphasize on that. So you can see here different antibiotics were applied to different particular microbes with tetracycline, gentamicin, and you can see what is happening there. We have a lot of resistance that's happening in this particular environment, and we need actually to address. And the use of biopolar material, ecologically friendly, but also available locally at low cost, is really working in Tanzania. So we have started with this particular work in a small scale, but in our near future, depending on grant availability, we'll be able to scale up now to different waste stabilization ponds at different regions, so that at the end of the day, we protect the Lake Victoria, where actually SOPHEA is working. So these are just some of the examples that we used for ciprofloxacin, penicillin, tetracycline, where actually we were trying to see how efficiently the biocular are working on different antibiotics that's available. The good thing with the proposed jamim seed biocular, it can absorb the antibiotic residues even at trace amount. That was really encouraging, because we had thought previously maybe it's only at high dose, but even at low dose, it can be able to remove from the environment. So you can see the functional groups at different temperatures behaving, okay, from the customization of 400, where actually we developed the biocular material, and you can see how efficiently in terms of the wave number and transmittancy of the antibiotics that's absorbed at different temperatures. So the surface morphology, once according to Darwin et al., once you calcinate it at 400 temperature, and here if you do it taking a significant look at it at a microstructure, so you can see these are the structure inside the bipolars, then you can see how they can absorb the antibiotics. This is the nature of the jamim seeds and how they can absorb the different antibiotic residues in place. So that's from the microscopic view of it. So you can see how the peak on the machine, if we want to now analyze it from the biocular, what has been absorbed, this is how using the CMD EDX image, and you can see at a temperature of 600. So for instance, if you look at this particular antibiotic, the removal efficiency observed, so the 5 experimental runs that we did at first was at 31 to 84, but we were able to optimize it up to 94%. So you can see, for instance, for Cipro, it's not slowly, but optimizing at different pH and different temperature. So you play on that until you have the optimal results. So now actually we are going even beyond 95 in terms of efficiency. So now in the field, we hope that you will be maintaining at least 95 to 96% efficiency of this biocular material. So the best results obtained at 8 pH, but with low initial concentration was less than 100 parts per million. So this particular model that we are using, as I mentioned earlier, it's actually advancing, and we see that you will be able to maintain above 95%, close out throughout our experiment and feed. So you can see from the statistics, the F value implying that the model was significantly, and it can be used to explain how this jamim seeds biocular is working. And you can see the R squared 0.99, indicating that this data fit well in selected model and among others. So you can see here different parameters that need to be considered, but most important is the temperature and pH, but also the time frame that the water will be passing through the residue. Normally, in this particular experiment, we are using 30 minutes to 38 minutes to pass through the biocular material, and that's the efficiency of 94%. So this is the calcination. And you can see how drop for Cipro, for instance, is antibiotics, how it's dropping very well at a temperature of 400. So you can see once you start at a temperature 100, slowly, but once the biocular are at the efficiency, and that's the 400 degree, you can see the Cipro removal is very high. That's why the calcination temperature is very, very important. Once you calcinate it at a low temperature, the absorption will be minimal. Okay, so these two parameters are very, very important, especially for Cipro and the APBR trademark. So remember, is increasing the surface area that matters a lot. So presence of antibiotics residues in water provides an opportunity for us to work on this efficient methodology to be able to remove. And then the jamim seed biocular adsorption has the potential properties, and they can be used in the removal of ciprofloxacin and lamivudine, among other antibiotics. So for now, we are confident with these two, but we will keep increasing in terms of other ones, so that at least we are able to remove most of the antibiotic residues at the different environmental conditions that are needed. So for now, we have optimized for these two, and we are keeping now on looking on how we can optimize it for the other three. And maybe in the near future, before we scale up, we will have already have the optimization for most of the antibiotic residues. So these are the papers you can read at your own time. So we did a review, we did a contribution of this drugs, but we also went to look on what is existing in the environment. But we published also on the removal of lamivudine from synthetic solution using the neem seeds. We published this specific data as well, but in the way how we can optimize. So you can read at your own to be more consistent with what I have mentioned in a nutshell. Thank you so much. And Sabine.
Thanks, Elias. Thanks. It's exciting to see that SOPHEA is not only about educational activities, obviously, and it's good to see also what kind of research activities are going on at the partner university. So thanks for your presentation, Elias. I think you're a bit restricted in time today, so you have to leave us early. But thanks for sharing your knowledge and wisdom with us, and great that we had you. So we go directly over to Jennifer Cole. Welcome again, Jenny. Dr. Jennifer Cole is a lecturer in global and planetary health at Royal Holloway, University of London. She's a biological anthropologist with a background in policy research. Her own research focuses on human behavior in response to social and environmental drivers of health. And among other roles, Jennifer is also a member of the SOPHEA Scientific Advisory Board. So Jennifer, it's always great to work with you. Over to you, and please share your slides.
Thank you, and thanks for having me back again. It's always a pleasure to be on the other side of this as well. So what I'm going to do in my presentation is look at particularly some of the health impacts along the planetary boundaries. My own research in this is very much really focused on heat and heat stress, but I'll bring in where that impacts on some of the other planetary boundaries as well. So the first thing I'll do is just give a brief overview of health in Africa. As I'm sure most people are aware, life expectancy in Africa is generally lower than in the rest of the world due to a whole series of inequalities that we can go into and cover. But where most of that life expectancy is particularly badly hit is in youth. You can see here, this is the number of newborns and children who die before reaching the age of 15 in Africa is much larger than in the rest of the world. And that is still really where a lot of that health disparity happens. And that ties in very nicely with Elias's presentation on antimicrobial resistance, because obviously infectious disease and inability to treat infectious disease is a huge part of that. But what we do know is that health in Africa is already poorer than in the rest of the world. Africa is already struggling with providing health and healthcare services. And then if you go to climate change, what you see almost is that map reversed, that Africa, and particularly countries in sub-Saharan Africa, are some of the ones that are most vulnerable to climate change. So Africa already has this double burden of being kind of struggling the most, perhaps most of the regions of the world, to provide healthcare, while being the most vulnerable to the impacts of climate change and environmental change. And yet and if we look at that particularly in terms of the planetary boundaries, this is, I apologise, these images here are quite small, but this is from a website created by Leeds University in the UK called A Good Life for All within Planetary Boundaries. And what they've done is, for every country in the world, and increasingly for cities as well, they map whether or not those countries and cities have exceeded planetary boundaries, but also whether they have achieved some of the social indicators of the Sustainable Development Goals. Because very much what they want to do is show that if we exceed planetary boundaries, we also have to do that while achieving the social goals of the Sustainable Development Goals. And what this creates, which sounds like you heard about in the last one, is the same donut of donut economics, which is this safe operating space for humanity. And what we see is that African countries, by and large, haven't exceeded the planetary boundaries. They are generally at the moment operating within planetary boundaries. But sometimes where they fall short on the Sustainable Development Goals is some of the more social indicators of things like equality and of education. So again, we're seeing that challenge of being able to live sustainably within planetary boundaries while actually having the equality that global North countries have. The countries I've chosen here are dotted around Africa, so I'm not focusing on one area. I'm looking at the area of Africa as a whole. So we've looked at Kenya, where a lot of my work's taken place, Liberia, in the northwest, Chad, which is more central, Morocco, which is close to the Middle East, and Tanzania. But as you can see, it's fairly similar as you look across Africa. So when we talk about planetary boundaries and a good life for all within planetary boundaries, Africa largely is not exceeding its planetary boundaries at the moment. But one thing that we do know from looking at other countries is that what tends to happen with the countries that have low planetary, or they're not exceeding their planetary boundaries at the moment, as they develop, they come closer to exceeding them. And what is very important with the planetary boundaries is to make sure that as countries develop, they develop cleaner. We know that shifts to cleaner energy, to perhaps better managed urban expansion, can prevent those planetary boundaries being exceeded while still meeting the social indicators in the centre. And this is particularly important from Africa, because we look at just one of the planetary boundaries, carbon dioxide emissions, and which countries are responsible for the carbon dioxide emissions and for that climate change, which is making Africa vulnerable. What we see is that Africa has very low carbon emissions. Again, Africa is not the cause of the problem, but it's suffering from the problems that are caused elsewhere in the world. You can see in particular the Americas and the Western Pacific region are the areas that have the most carbon emissions. Europe is doing reasonably well for the world overall, but Africa is not responsible. And what this also shows is obviously there are large cities, there are mega cities in Africa, but you can have mega cities as a country without, as a continent and a region as a whole, exceeding your planetary boundaries. It is possible. And so what we're really looking at is bringing these things together. We need to make sure that health systems, health services, healthcare professionals are able to provide the healthcare that a population needs, but they need to do that within planetary boundaries. And at the moment, Africa is really bearing the brunt of the rest of the world's exceeding of planetary boundaries. And what we can see as one of the consequences of this is that as it is in most places of the world, annual temperatures in Africa are increasing. You see this is probably a common graph to most people. Temperature always fluctuates from year to year. It's sometimes hard to see when the beginning of a curve starts. You may have perhaps thought it was starting to go exponential here, but then we get a colder and wetter period in the middle of last century, to the middle of the end of last century. But then it has definitely been increasing since around about 1990. And what this means for Africa is it's having those health impacts that the rest of the world is seeing as well. And just to give some of those figures, you can see, 110 million people directly affected by heat-related hazards, things like heat waves, floods, tropics, cyclones, and droughts. And obviously that has impacts on other planetary boundaries, such as land use and water. It's facing 8.5 billion annual economic losses, and around about 5,000 fatalities caused directly by severe weather events. And those are usually most of those are either drought-related, where food can't grow and therefore people just don't have enough food to eat, who could be flooding related, where people are killed directly in floods, or again, the floods have a severe impact on the production of food. 55% of the African economy is dependent on agriculture, but this has actually been declining. So again, what we see across the world is that the climate gets more erratic, less reliable. People try to move away from farming economies because they're very dependent on the weather. And so this has economic impacts as well. And one of the impacts that it's predicted that will have in Africa is that food imports will triple. And so that Africa will try to import more of its food elsewhere as growing its own food in country becomes more difficult. And that obviously has implications both for the economy, but also what we know is that people who don't have their own land, and whether that's at the family level to be able to grow your own vegetables, whether that's at a community level to have community gardens and farms, or at a national level, those countries are more susceptible then and more vulnerable to food price increases across the world. So the less of your own food you're able to provide, the more you are likely to lose out if there are wide-scale either droughts or floods or food production issues across the world. And obviously the links between health and nutrition don't really need to be stated. This is causing a huge amount of loss annually to the economies, which prevents African countries from being able to develop as quickly as they would be able to, and perhaps also sometimes to invest in the things that we know would save money and improve health down the line, or to go for some of the more innovative, but at the moment more expensive options. And there are also concerns that some of these challenges could then fuel conflict and displacement, particularly if perhaps if people move around because their farming land has become less easy or less reliable to farm than it's been in the past. And we can see that all of these have knock-on effects. There's lots of research has been done on the effects of displaced people, and we know that displaced people tend to have poorer health overall than the communities they move into. They also tend to put a strain on the healthcare of those communities. Particular impacts that it has, we know that heat stress and climate change in particular impacts, for instance, cardiovascular vulnerability. People who particularly have cardiovascular conditions are more susceptible to ill health in heat waves. We see hospital admissions go up, which again has a big impact on the economy and on the healthcare workforce. There's neo and perinatal vulnerabilities. Babies are much less able to regulate their temperature than older people. We also see increased infectious disease, which again, babies are more susceptible to. So we see potential increases again in childhood and child mortality, which is already putting a burden on Africa's health. We see problems such as heart rate dysregulation, blood pressure dysregulation. We also see increasing dermatological issues, both just from prickly skin, heat stress itself, but also from fungal infections. We see increased chronic kidney disease, and in particular, some of the work I'm doing at the moment in Cambodia, we're seeing huge increases in chronic kidney disease due to higher temperatures, and that's particularly where it's hot and humid. And we generally find that actually in terms of climate change and environmental change, for human health, hot and humid is actually much worse than heat on its own. And we also see increased fungal parasites, which also impact health. Again, there are lots of statistics about the way that health is being impacted, but in particular, as I mentioned before, infectious disease is a big increasing area where you have environmental change. And that goes back from conditions becoming more favourable for virus or bacteria spread. Usually if it's hotter, if it's warmer, the vectors can range further. There may be more vector breeding grounds. We're particularly seeing across the world where temperatures are increasing, things are becoming more humid, increases in dengue virus, but also in malaria, which is already a problem in Africa. And this is exacerbated where you have rapid urban expansion that brings with it poor sanitation, poorly planned urban expansion, and this can go together to cause poor nutritional status. The work that we've been doing in Kenya with the University of Eldoret, one of the results that's come out of that research, which was not expected, is that what we were trying to show is that a family has its own land. If it's able to keep perhaps its own dairy cow and chickens, that's likely to have a better nutritional output for the family and the children. We found that is true, but it is only true if the family also have improved sanitation under the World Health and UNICEF definitions of improved sanitation. If you keep your land, you keep your animals, but you don't have improved sanitation with it, the increasing risk of infectious disease from that less hygienic environment actually offsets the benefits of the extra nutrition you're getting from being able to produce your own food. You can expand cities in the way that allows room for urban gardening, for small-scale farming to be maintained, but it has to be planned that way. And there has to be room for animals and for community gardens left within that city. What we see with a lot of global north cities that are sometimes populations are reducing as population shrinks is that where there is empty space in those cities, that's where small urban farms and urban gardens open up again. But actually, there's no reason to lose them in the first place. We increasingly know that more green space is better for all kinds of health, from mental health to community cohesion to exercise. And if we can keep that space for urban gardens and urban farming within the cities, it improves health all round. And what you also need to that is to make sure that there is room for a healthcare infrastructure in that, so that as cities grow, the healthcare infrastructure grows with it and provides the healthcare that people need. We know that early intervention in health, investment in preventative health rather than treatment after the effect, saves money along the line. So the more that we can actually plan this in, with the knowledge of how climate change is going to impact individuals and communities in the future, the more we can actually make sure this is built in during periods of urban expansion. Sort of a real challenge with any area that is expanding rapidly is poor urban planning. What we also see is areas of huge wealth disparity, where you have very kind of modern, very affluent, very say in healthy cities like this, but very close to informal settlements. And that can have implications for both. One of the things we're saying, again, going back to antimicrobial resistance, which is my main research area, is that we're seeing that antimicrobial resistance and antimicrobial resistant bacteria spread more quickly through lower income regions and through lower income markets and cheaper meat than they do between kind of higher, more affluent food chains. And so this can actually be if you're not bringing up the whole city at the same time, if you're not dealing with these issues of inequality, you're actually opening up health impacts for the entire country. And if you have that on top of climate change, you're trying to deal with everything at once. But if you don't build climate change into those plans, you won't actually think about how that expansion can be planned. We see definitely with heat stress, we see issues with famine, and particularly with drought. And what that might mean again is that as countries go forward, as they look at their food supply into the future, that may involve having to plan, perhaps changing some of the crops that they grow or the strains of the crops that they grow. But it's extremely important to plan that well. What we've seen in some of our research in India, where a lot of the crops have moved over from the traditional Indian maize crops to American maize, which is more drought resistant. It's also brought with it invasive parasites, which have had impacts not only then on the maize crop, but also on other local crops such as chickpeas. So if you are looking to adapt the farming that you're doing to account for drought, you need to actually do that very carefully to make sure it doesn't cause more problems. We see as well that drought will push farmers from crop farming into livestock farming. If that livestock farming, again, is not well managed, if the farmers aren't really given support to be able to manage their livestock properly, that can see a huge increase in the use of antibiotics that are used. And also we know that increase in livestock has, that the land use moving from crops to livestock is also a way that you can exceed planetary boundaries very quickly. So you need to be keeping the whole system in place as you go forward with this. Flooding as well, we see lots of issues with floods. That again has issues with fresh water on the planetary boundaries. This is increasing, and it said again what we know from climate change is it's not only the heat, it's heat and humidity together that causes the problems. Add this in with some of the problems I mentioned about already with sanitation and making sure the expansion of sanitation is planned properly. This all adds to the challenges. I said we're working at the moment in Kenya in particular. We're looking there really at the aquaculture and some of the challenges with expanding aquaculture and moving fish around tied into the climate change challenges. One thing we do know is that fish can actually be a more sustainable form of protein production than, for instance, chickens, where the climate is increasing. If the climate is getting hotter and wetter, that's actually easier to expand aquaculture than it is to expand some other farming. But how do we do that in a way that makes sure we don't store up all of these health problems? So we're looking really at how do we develop sustainable food systems for Africa? How can we increase research capability and particularly in One Health, so making sure we're looking at that human-animal health system together. And with the University of Eldoret in particular, we're looking to create a centre of excellence in East Africa and also to help Eldoret win more funding for investment in research infrastructure. We're very keen to make sure that we tie that with SOPHEA as much as we can. It's been great to link up some of the work that we're doing with Eldoret, with QHAS and Tanzania. We're hoping to do that, as you know, further with some of the universities we work with across the UK and Germany. And I think the more this network maintains itself, beyond the life of this project, and creates more of those networks to work together, the more we will be able to help move this forward in a way that most importantly stays within the planetary boundaries while ensuring health for all within that safe operating space. Thank you.
Thanks, Jenny. Thank you so much. Thanks for the presentation. I think we will directly move over to the third speaker. I saw some hands being raised in the meantime. You're very welcome to type any questions in the Q&A window, and then we will try to address them there directly or bring them up during the panel discussion at the end. So that would be the way to go. Now I'm happy to welcome Oskar again. Oskar was with us last week as well. So welcome again. Oskar Masztalerz is a planetary health scientist and educator based in Berlin, Germany. He's a medical doctor and a geographer by training, and he works at the Charité, which is a medical university here in Berlin, at the Potsdam Institute for Climate Impact Research, the PIC, and also at the German Advisory Council, or for the German Advisory Council on Global Change. Oskar, nice to have you with us again. You're welcome to share your slides and then kick it off. Thank you.
Yes, thank you so much for the nice introduction again, and the invitation to be part of the second session of the webinar series today again. Thanks also to the speakers who were speaking before me. It was very interesting for me to listen to you. And I think in the following 15 to 20 minutes, we will come across many of the topics. We will also touch many of the topics briefly that you were already mentioning. So thank you so much so far. So I will speak about planetary health, which is also in the title of the webinar series, exploring pathways to safe, just, and healthy futures. Here first, I will briefly introduce planetary health as a health concept and research field. Then we will have a closer look at the two cross-cutting themes of planetary health, which are justice and transformations. And in the end, I will speak about health systems in particular, and show a variety of concrete options for action that can be taken in the context of global environmental changes. So first, let's come to planetary health. Just a little recap briefly from last week. This is our planet, and we see an increasing acceleration of many trends regarding our resource use and our emissions. And so it's discussed that we are on the Anthropocene trajectory away from the stable Earth system of the last thousands of years into an unsafe future, which will be largely shaped by humans. But how the future will be on this planet largely depends on what we decide to do now and in the next years and decades. And we already know we are far beyond many of the planetary boundaries. Jennifer was just explaining very impressively with which many health risks this comes along. And we also discussed last week's about that where our planet will move decides on what we do here and now. And it's not only about if we'll be in a safe or unsafe future, but also if the future will be just regarding the effects of climate change and other environmental changes. So how to come to the safe and just planet in the future, that is the big question. And planetary health can work as a very suitable framework for exploring pathways towards this safe and just corridor for the future. The motto is safeguarding both human health and the natural systems that underpin it. And there are a variety of definitions One could be planetary health is an integrative, transdisciplinary, and transformative health concept, research field. Oh, I notice that my slides are jumping. Research field and social movement that understands the health of people and ecosystems as inextricably linked. And it goes back to an article from 2014 in The Lancet, From Public to Planetary Health, a manifesto, where it was written that the harms we continue to inflict on our planetary systems are a threat to our very existence as a species. The gains made in health and well-being over recent centuries, including through public health actions, are not irreversible. They can easily be lost. So what means integrative, transdisciplinary, and transformative? Integrative because the health of humans, ecosystems, and other life forms is viewed as inextricably linked and in strong relation with each other, depending on each other. Transdisciplinary because not only in different scientific disciplines, but also other actors and forms of knowledge should be included in the discovery of solutions. And transformative in the sense that science is not only regarded as the goal of science is not only regarded as describing problems, but also actively contributing to finding solutions. So in 2015, there was the big Rockefeller Foundation Lancet Commission report on planetary health. And in the same year, also the Planetary Health Alliance was founded, which now has more than 420 members worldwide. And in 2017, the Lancet Planetary Health, an open access journal, was launched. I can strongly recommend to look into that journal. All the articles are available for free. So what's the perspective of planetary health? We have underlying drivers of environmental changes, which are connected with societal trends and subsystems, such as mega trends like urbanization, subsystems such as our nutrition systems. Underlying of these drivers are root causes connected with power relations, values, norms, and paradigms. And these drivers now lead to environmental changes. We talked about that in detail last week. Coming with a variety of health risks for humans, from local climate changes and extreme events over decreasing food quantity and quality, up to reduced options for contact with biodiverse nature and so on. And how these health risks now really affect people is shaped by a range of modifying factors, which are determined by the participation, economic participation, political participation of people, by their access to health resources. And here it is important that we have to look at vulnerability factors from an intersectional perspective. And in the end, we have a range of adverse health effects from malnutrition over infectious diseases to non-communicable diseases. The last lecture was going into detail here. So when we look at this perspective of planetary health on environmental changes and their health risks, it becomes clear, this is also discussed in science and in the current discourse, that incremental measures, so only changing small things here and there, are not enough to solve the intertwined ecological health and justice crisis that we are facing right now. And it also appears to us that the drivers of environmental changes, as well as the modifying factors, are both characterized by multiple inequalities on a global and on a local scale, which was already pointed out in the prior lecture as well. Three groups of challenges are discussed in the field of planetary health. They are also understood always slightly differently, but this could be one possible description. So we have knowledge challenges regarding understanding the interactions of humans, ecosystems, and the Earth system, to reduce drivers and health risks of environmental changes and to promote healthy nature as a foundation of health. Implementation challenges, which are about the development and implementation of strategies and measures to protect and improve human and ecosystem health, connected also with equitable use of global commons and the reduction of inequalities. And we have imagination challenges, which are about the analysis and overcoming of the root causes of anthropogenic environmental changes connected with the reflection and transformation of fundamental perspectives and social paradigms. So we have seen justice and transformations can be described as two important cross-cutting themes of planetary health. And in the following, I will just briefly introduce some topics which are currently discussed in the scientific and societal discourse regarding planetary health, just to provide you with some insights and also to stimulate further discussion later today. So one topic which is discussed, and I already mentioned it, if we really want to design solutions that are not reproducing or reinforcing or vulnerabilities or producing new vulnerabilities in terms of maladaptation, it can be very helpful to conduct a critical intersectional analysis of inequalities, which means that different vulnerability factors and categories of discrimination are not seen separately from each other, but as overlapping and interacting and also embedded in overarching societal structures and also power relations. We know that graph also from the last lecture, in the last webinar session, where we see that privileged people contribute way more to environmental changes than marginalized people, and the vulnerability is way higher for marginalized people in many cases. And on the bottom, we see all these different factors here are intertwined in the form of a rope, which also refers to an intersectional perspective. Then another topic is that we need, on the one hand, adaptation, continuous adaptation to dynamic changes in our environmental conditions. But on the same time, we need to strengthen resilience, which is often more referred to resilience against acute crisis and shocks. But the both terms are also defined quite differently in different publications and from different actors. So that would be one option. What is important for me is that we need both, like the continuous adaptation as well as resilience with regards to environmental health crisis. And connected to both of them is that it's increasingly coming to the agenda that we need an integrated environmental and health protection. So there are so many measures regarding lifestyles, but also regarding living conditions of people and regarding protection of ecosystems and so on that can have both positive effects on both the environment and human health at the same time. And if we look at both fields of action from an integrated perspectives, we can lever a lot, or we can use a lot of co-benefits and additional positive effects. Then one topic which is also discussed is that we need transformative and systemic approaches. I already referred to that earlier, so that we don't only look at determinants of health and also environmental degradation separated from each other, but that we see always these determinants in their overarching systemic contexts, and that we really take a transformative action, which means or which can mean, for example, also different definitions here, but which can mean, for example, changing the basic structure of socio-ecological systems. Then one point is, which was pointed out last week as well by Remco, that it is discussed that we need a reorientation of our economic systems. Just here a recommendation from my side, the Health for All report by the WHO Council on the Economics of Health for All from last year, where we can read inter alia, we need to value and measure the things that truly matter, human and planetary flourishing, rather than pursuing economic growth and GDP maximization regardless of the consequences. To achieve health for all, governments must rethink value and reshape and redirect the economy based on social and planetary well-being, guided by new metrics, which is very important. And planetary health is also one major field of action identified in this report. Planetary health in all policies is a term which is not yet commonly used, but which you can find here and there already. So referring to the health in all policies concept to really integrate environmental changes and their health effects, health risks, and especially action against environmental change and these health risks in all policy fields, which is necessary because we have to work together across sectors, across disciplines, and across policy fields to change the causes and the drivers of environmental changes and to protect people from the health risks. Then it is increasingly discussed that we need a diversity of solutions and also forms of knowledge and actors, including indigenous and traditional knowledge more strongly in the development of solutions is also pointed out by the IPCC and IPBES. That's discussed on a very prominent level so far. However, it's practical options how to really do that, how science and other forms of knowledge, or how Western science and other forms of knowledge can really work together is still to be discovered. This is also connected to the last topic, which is discussed at the moment, that we need a reflection of values, norms, and paradigms, which are underlying these drivers of environmental degradation. Connected with the long-standing suppression of diverse forms of knowledge in the last decades and centuries, also as a legacy of colonialism. We also find that there is kind of a predominant human-nature relationship, which is strongly based on the exploitation of natural resources, now globally to be found, and that we have to think about how can we live in a stronger symbiosis with our ecosystems and with our Earth system and as a whole. As was already pointed out earlier, in different fields of action, we can now apply all these different cross-cutting issues and transformative strategies. And here just some examples on how we talk about that in our course on planetary health at the Berlin University Hospital. For example, we have one session on urbanization and the transformative power of cities, one session about transformations to just and sustainable food systems, and one session about transformations of economies for people and planet. Just to give you an insight, we also cover a lot of other topics, and some of our materials are also freely available under a Creative Commons license. So that leads me to the last topic of my talk, harnessing the transformative potential on health systems. So let's look at a variety of very concrete options for action, realizing such a planetary health approach in one important area, which is health systems. Here I will talk about what we were writing at the German Advisory Council on Global Change, where I'm working as a research analyst in the last flagship report, Healthy Living on a Healthy Planet, which was released last year. And there was developed a vision which is very much in line with the planetary health approach, which is based on these different aspects: people as part of nature, stronger prevention and resilience, inclusion instead of exclusivity, cross-system cooperation, and planetary guardrails are respected. The Council was pointing out that we need three complementary approaches, and we need to apply them to apply all the three of them to human health as well as on ecosystems. On the one hand, reaction and repair of damage, but also a stronger prevention to reduce risks and dangers, and we need to strengthen resilience and development potential. And this all can go hand in hand. I invite you to have a look at the report. Different topics and fields of action I've covered there. But I will focus now in the last remaining minutes on the chapter on health systems, harnessing the transformative potential of health systems. And there are 3 fields of action identified. First, environmentally sensitive prevention and health promotion, which means healthy ecosystems are regarded as an important prerequisite and resource for health, and environmental changes are recognized as important determinants of disease. And some key measures here could be to give patients information about new health risks and inform them about individual adaptation measures, to do lifestyle interventions and also structural measures to reduce risk factors and promote sustainable behavior. Within these measures, it's always important to give special consideration to disadvantaged and marginalized people. And this could have a lot of key benefits. On the one hand, promoting healthy and sustainable lifestyles, which often happens at the same time. So healthy is often sustainable and vice versa, which is an important lever. It could lead to the initiation of measures for structural prevention, to reduce vulnerabilities and strengthening adaptation and resilience in the population, and to reduce, in the end, also the demand for resource-intensive treatments if disease is prevented or discovered early. So this field of action would work at these points here in our planetary health schematic. The second field of action is strengthening adaptation and environmental resilience. And that's about being prepared for all environmental changes, not only climate change, but also for all the other environmental changes and the health risks and possible health crises. This is a graph from the latest IPCC report showing what resilience in health systems could mean after a shock to come out in the end at even a better state than before, because we have learned from a crisis and are better prepared for the next one. Here also some important actions are to be done. First, to consider environmental health risks in anamnesis, diagnostic, and therapies. Then we can establish resilience strategies in healthcare facilities, and also design healthcare facilities with appropriate protection against environmental health risks. And this field of action, also structural overarching measures are very important. For example, to strengthen public health departments and cross-system cooperation, enhance structural resilience, for example, by strengthening supply chains and infrastructures, and very important, to establish integrated environment and health information systems to be able to conduct regular exposure, vulnerability, and adaptation assessment. This field of action is mainly happening here when we look at our planetary health schematic. The last field of action, transformations towards sustainability. The goal is here reducing emissions and resource use in health systems, which is about environmentally friendly production and use of pharmaceuticals, products, instruments, and technologies. And we urgently need a stronger development of such environmentally friendly products. Then improving the sustainability of infrastructures and health facilities, but also reducing inappropriate care, including over and underuse, which both can not only lead to health risks for patients, but also to unnecessary resource use in the end, and to make use of opportunities for influence beyond health systems. Important is the fundamental principle that must always apply to all transformations in health systems is that at no time may action be taken against the well-being or health of patients and staff in order to save resources and emissions. That is clear. Necessary and reasonable medical measures must always be carried out properly. And if we then take sustainability criteria into account, it makes it possible to prevent negative environmental impacts and illnesses caused by them, and to generate additional multiple benefits. And this field of action is mainly tackling here the underlying drivers. So there's also a fact sheet about this chapter in the latest report of the Council, and the English version will be available soon on the website. Just last outlook, I also recommended to you, if you don't know it already, the Planetary Health Case Studies Anthology issued by the Planetary Health Alliance some years ago, covering a variety of best practice projects from all over the world, which are working with environment and health protection at the same time. And in particular, I can recommend, because they are very strongly intertwined to health systems, the Health and Haze case study, also medical clinics for planetary health, where environmental degradation was prevented, and its negative health effects were prevented by providing a better primary health care to local populations. And also family planning for people and planet, which is about the whole LVB project, which probably most of you will know, in the Lake Victoria Basin. So thanks for listening. If you have any questions, please put it in the Q&A window, or we can discuss it. Thank you so much.
Thanks, Oskar. Thanks for this very comprehensive overview. Enjoyed it a lot. Thanks. I can also highly recommend the WBGU, the German Advisory Council's flagship report that you mentioned, which I think gives a lot of practical issues, how really living, like if you look at food systems, transportation or mobility and some others, how really living under all aspects within these planetary boundaries is useful. I think this really helps to envision and to overcome this imagination challenge also, as you were saying. And I think this really gives some very practical examples and visions for the future. So thanks a lot. We are already a little bit behind time, so I'm trying to be quick. We are doing a quick break now before we hear from our last speaker, Hashim. So we do a 5-minute break. Eva Maria has already pulled up the poll. Similar to last week, we would like to hear a little bit from our audience as well, where you're from and what your professional background is. So during the break, you can answer these questions, and then we will be back at 1:15. Thank you. So I welcome you all back. I hope you had a chance to answer these 2 questions. It was always nice and informative for us to know who is signing up for these lectures, who we are reaching, who we are maybe not reaching. So thanks for your replies. We now have the opportunity to hear from Dr. Hashim Hounkpatin. I'm probably not doing very well with pronouncing your family name, so apologies for that. Maybe you can clarify later. I just quickly introduce you, and then you can start your presentation, Hashim. Hashim is a medical doctor and a public health researcher. His work on climate change and health was awarded the Antwerp Prize for Global Research in 2023. Congratulations again. He's dedicating his career to healthy people on a healthy planet. And I think this perfectly fits our webinar series. Hashim, welcome again, and please, over to you.
Thank you very much, Sabine. Thank you, everyone who was able to spare his time to join this conversation. And thank you to SOPHEA for providing the platform and the panelists that came before me. I will mostly build on what they have shared so far. So we have seen the health impact of climate change widely covered by Jennifer. Climate change refers to the long-term shift in weather pattern, and it affects all dimensions of health, either directly or through the social and ecological system. But in the sub-Saharan African context, the climate and health literature is juvenile and dominated by impact studies. That's why we undertook this study to understand how health systems in sub-Saharan Africa are adapting to protect human health from climate change threats. We combine a scoping review and a case study, the Benin case study, which for various reasons is a typical instance of adaptation policymaking process. So I will happily share the main findings with you, starting from the answer to the question, how are health systems in sub-Saharan Africa adapting to climate change? And indeed, they are already adapting. And what we have seen is that they are doing so through measures, adaptation measures within 7 domains, as you can see. And the first one is health systems strengthening. We know that health systems in sub-Saharan Africa have been weakened by decades of underinvestment, structural adjustment plan, brain drain, technology dependency, and they are using tools like the WHO framework for building climate resilient health system to strengthen the health system towards climate change. And just to give a word on that framework, it was first developed and published in 2015, but last year it has been updated, and it builds on the health system building blocks, basically. The notable change is, as you can see there, the not only resilient health system, but also while building resilience, we need to lower health system carbon footprint. Policy is at an advanced stage in sub-Saharan Africa because it is considered as an umbrella for other measures, and they are doing so, the health systems and the countries are doing so by mainstreaming climate and health in policies. But we will see this later in the case study. The dominant role of global governance is leading to policy mimicry across sub-Saharan Africa, and regional and subnational levels are mainly overlooked. The policy stays at the national level most of the time. Financing is the main barrier for adaptation actions, and one reason why it's that is that most of the sub-Saharan African countries are relying on international funding to fund the adaptation policies and actions, both for historical reasons and pragmatic reasons. They are also advocating for cancellation of historical debt and reform in international trade so that it becomes less predatory. And those 2 actions could allow them to mobilize funding to invest in climate change adaptation. We have said this at the beginning, the data paucity at the climate change and health nexus is alarming. However, countries like Nigeria and Lesotho are using extreme early warning system to communicate climate risks to their population. They are also building capacity to cascade climate change adaptation actions across sectors. Countries like Rwanda and Malawi are educating their population on heat management and vector breeding removal, site removal. They are also investing in social protection as a way to strengthen people's resilience. but drastic climate events such as the shrinkage of the Lake Chad is leading to migration. And one speaker said this before, most of the time migrants in the host country have limited access to healthcare. And an example here was provided for Zimbabweans living in Botswana who fear seeking healthcare services, both because of the poor attitude of healthcare providers and fear of deportation. The next action that countries are taking is around disaster prevention, preparedness, response, and recovery. So they are doing so by building climate-proof infrastructures. In Sierra Leone, they are investing in cool roofs and flood-proof buildings. But because there is a but in Mozambique, and this is an example that is true for many other countries. We have seen a lot of climate events in Mozambique, especially the cyclones, but it's only at the acute phase of the events that international humanitarian aid flows in. But after that acute phase, the recovery part of the management, disaster management is overlooked, and the country is left to its own. And in the specific case of Mozambique, they have recurrent cyclone, and they never recover from the first before the next hit. Last but not least, mitigation. Mitigation because mitigation, adaptation goes hand to hand with mitigation. And we could even conceptualize that mitigation is part of adaptation. In sub-Saharan Africa, most of the households rely on dirty energy for cooking, for lighting, and that generates indoor pollution and premature death, especially among women and children. And though a fossil fuel phase out is expected, countries in sub-Saharan Africa are advocating for fossil fuel use, especially now that they are discovering new sources, both for the reasons that we mentioned before. They need to develop, they need to reach the level, they need to cover their population's needs, basic needs, etc. So let's turn now our attention to the Benin case study, and that will show us a national adaptation plan policymaking process. So first, Benin is a coastal country in West Africa. It has signed dozens of international climate conventions, and it has national policy instruments. In the National Adaptation Plan, we have 8 sectors that were prioritized. So the National Adaptation Plan was released in 2022 after a 10-year process. And the health, it is a single document combining the 8 sectors, and the health component of it prioritizes 3 climate hazards, heat wave, flooding, drought as the main climate events worth focusing on. And they tied some health risks related to those climate change hazards. And a key finding here is that most of the health risks that were identified were on the physical dimension of health, and the mental and social dimension of health were not tackled within that adaptation plan. And we mentioned the policy mimicry across the continent, and that was confirmed here in Benin within the National Adaptation Plan. The plan adaptation categories, the adaptation categories of overlap with the one that we have seen in the 7 that we have seen for the sub-Saharan African countries. There you can see the actors the main actors that were involved in the National Adaptation Plan policy-making process. It's funny that we are within a German environment here, but the Ministry of Environment of Germany commissioned its International Cooperation Agency, GIZ, to technically and financially support Benin in its National Adaptation Plan process. And GIZ did that by hiring expertise, climate analytics, CPED, and additional funding was sought from Green Climate Fund and UNDP. So at the national level, so those are the main international actors that were involved in the, directly involved in the policymaking process. At the national level, the agency was hosted by the Ministry of Environment within the government, and the parliament was involved for legislative development. So let's look at the process now. I was saying this before, it was a 10 years process that started in 2013 and ended in 2022. The National Adaptation Plan covers the time frame from 2022 to 2030. And three key events worth mentioning here include the health vulnerability in 2017, the health sector vulnerability and adaptation assessment studies. So that study was the study that informed the National Adaptation Plan. So it's a kind of situational analysis, but that study only lasts 6 months. It only covers one disease, malaria, and it only covers one health district out of the country's 34. The second important information event here is the 2020 methodological guide for climate change integration in policies that was developed, and that is supposed to support the country's health in all climate change and health in all policies approach. When we think about it, we give it a second thought. Climate change is not only the only crisis that we are going through as a global community. We are going through different crises, as you can see at the tip of the iceberg. But we can react to the crisis as they pops. We can anticipate them. We can design we can design so that we address the systemic structures of it, or we can transform the root causes. We can transform by tackling the root causes of this crisis, and that was a little bit covered by Oskar, mentioning the root causes of this anthropogenic climate change crisis, which ultimately is due to human behavior and how he views the world. Building on this, we are having a mix of adaptation scenarios in sub-Saharan Africa. We are having the bad, the good, the bad, and the ugly adaptation. So with the ugly adaptation is the adaptation that is selfish and selective, focusing on individual, on countries, etc. And that pattern was seen during COVID-19 pandemic, where face masks and vaccine were hoarded by the global north. The adaptation can be good, that can be bad, can be bad. And it is bad when it is a top-down bureaucratic approach to solving it. It can also be bad when we do not tackle the root causes of the crisis. We just react to it. An example is heat and air conditioning. When we have a heat wave, turning on the air condition is a good reflex, rightly so, because it cools down the body and lower the effects of the heat. But when we see the impact that air conditioning can have on environment in terms of adding to the heat, in terms of polluting, and in terms of creating poverty energy that is supported by outdoor workers, mainly those living outside, who comes to be the less privileged, we know that that adaptation strategy is a bad adaptation strategy. Finally, on the bad adaptation strategies, we can classify the wastage of resources. So resources that are mobilized in the name of adaptation, but end up being wasted, lead to adaptation scenarios that are bad. And to prevent that, Magnan has suggested an ex-ante approach to capture the risk of maladaptation, the bad adaptation, before we actually invest money and resources in adaptation. Having the iceberg in mind, the adaptation can be good as well when it is embedded in positive values and principles, reminding ourselves once again that we have an anthropogenic root of this climate crisis. We need also to have action, but action at the right time, at the appropriate time, and when the windows of opportunity to act is there, we need to act timely so that we do not have irreversible consequences or long-lasting consequences. Finally, we need to think in systems, as we have seen before. We need to think in systems to make sure that the reactions, the adaptations, actions that we are having, we understand how they influence other elements within the system, the health system, and other systems ultimately. So that was what I wanted to share with you. Thank you very much for listening, and I'm looking forward to answering your questions. Thank you very much.
Thank you so much, Hashim. This was really interesting. I always like it when it becomes a bit more practical and breaking all the theory down into action and interventions. So thanks for that. The speakers are now taking with me a seat on the panel table. So Eva Maria is kind of rearranging us a little bit, and then we will see if we can take some questions. In the meantime, maybe just one remark. Looking at your presentation, Hashim, there is a global survey on climate change and health by the WHO. I think the last one was published in 2021 that kind of quantifies a little bit worldwide what you have been expressing. Like, you pretty much outlined what kind of methodologies exist towards adapting. And within the WHO survey, it kind of quantifies what kind of status quo do we have worldwide on adapting, really. And I think I just pulled out some figures there, which was 70% of the surveyed countries have actually a national climate change and health plan or strategy in place, which, wow, seems quite a lot. But you also gave some hints in your presentation that sometimes the value or the quality of conducting these assessments, or also putting the strategies in place, and who are considered, who is part of the decision and planning process, is maybe sometimes less than ideal. But what I found also remarkable that within that survey, it was stated that the implementation of these strategies very often remains very low because of lack of funding and capacity. So those were the two main reasons for low implementation. So maybe just in addition, you're welcome to comment here as well. Otherwise, I want to pull out some questions from our audience. Okay, I think there were, Eva Maria, if there's anything coming to your mind, you're welcome to jump in. Otherwise, I will pull out a question that I saw in terms of starting this entire process. And maybe that, again, is a question to Hashim. What is the best first step in this process of developing a national adaptation plan, if it is really essential to know the ecological footprint of a health facility, of a health sector of a certain region once before you make a plan to lower your carbon emissions, or how do you actually start to develop that? And I think you already gave some hints, but maybe you can just recap once more to make it more obvious to people.
Sorry, what's the question?
If you can just recap on the entire process of implementing the WHO framework on low carbon and resilient health systems. As you were saying, it is ideally the first step would be the assessment and then rolling it out from there. But maybe you can just elaborate on this a little bit more. I feel like there might be some people online who think, okay, where to start? How do we start putting all this knowledge into practice? How can I take this home and do the first step in my profession in my home country?
Yeah. Okay, thank you very much. So before the National Adaptation Plan is released, we need to base the options that we choose within the National Adaptation Plan on facts. And those facts come from that vulnerability and adaptation assessment. So we assess vulnerability in terms of climate hazards, what they are and what do we prioritize within our context. Next, what are the health risks tied to them? And next again, what are the adaptation options related to each of the risks that we have identified? So the vulnerability and adaptation assessment serve to answer those questions. And there is a document by WHO to guide countries doing that assessment. And they are quality criteria to develop a vulnerability and adaptation assessment. You need to cover the whole country. You need to be the most comprehensive as possible, and collate the best available evidences to do that. And when you do that, you need to, you have a step of stakeholder consultation to talk with different stakeholder groups at the national level in different sectors, because this is a cross-sectoral process. And also you need to talk to civil society, you need to talk to the people, because they have alternative knowledge different from the mainstreams that they need to put within this process. And later on, you develop your adaptation plan based on those information that you gather. The specificities of Africa remain what they are. In the case of Benin National Adaptation Plan, for instance, you see our boundaries do not reflect any climate divide. So something that could be a good idea in a context where resources are scarce would be, for instance, to have economy of scale in a term where a country could develop its national adaptation within a regional frame. In West Africa, for instance, we have the West African Health Organization, but it is not involved in the national adaptation process. And each country is developing its national adaptation plan at its own. And they are gaps, those kind of gaps, we can elaborate more eventually, but they are those kind of gaps that can be leveraged on, that we can build on, that we can tap into as an opportunity. So I'm not sure if I answered the question right.
Thanks for your answer. The other panelists are welcome to jump in as well. I think maybe one remark that is, often the hurdle there is a question around funding and also capacity. I think with the SOPHEA project, there is a lot of effort going into capacity building and also research, as Elias was saying in the beginning, to really do context-specific and context-relevant research, not only to the challenges, but also to maybe solutions that need to be identified that really fit the context. And having that capacity plus funding, I think, is really critical. In your case, you received external funding for this endeavor, which is a huge task. And unfortunately, often, especially in our times now that we have so many competing crises, it is often challenging to receive this kind of funding.
And maybe add on what you said. Actually, the process took 10 years. It didn't need to take 10 years. It took 10 years. One of the main reason is the availability of funding. So it's only when the fund was secured that they needed to go quickly to have that vulnerability and adaptation assessment and to have that national adaptation plan ready. Also because you need to, so the funding availability is backed by some steps that the country need to take first. And most of the time, the capacities and the funding to take those steps are missing. So that's why that process took that long. In Cameroon, for instance, it took only 3 years.
Yeah. And in that way, I mean, maybe the resolution by the World Health Assembly and having this clear framework really provides guidance and directions for governments, countries to align policies and interventions as well as funding streams. So I think this is really critical, and in this way, a good measure or instrument to steer priorities and interventions. I have another question. I mean, I'm just sorry. I have so many questions for you. Eva Maria, help me out. If there's anything in the Q&A, I don't see any right now.
No, I think you can move on with your questions for now.
Okay.
Still.
I have another question for Oskar. And I find, I assume many of our audience will be from a health background. There will probably be a lot of doctors, nurses, other health professionals that are online. And I'm sure we're already well aware or even now informed of that transformative potential of health professionals. So, I mean, just to break it down once more, how can we all become change agents? How can we be active, little chains in this big transformation process? So maybe I have two questions for you, mainly Oskar. How can we become change agents? And secondly, big questions. Where do you see maybe opportunities and also challenges if we are looking again at Africa, because this is or East Africa in particular, because this is the focus of SOPHEA. I leave it up to you where you start. Two big questions. And Jenny, you're also welcome to jump in because you've been in that sphere for such a long time.
Yeah, thank you. I doubt that I will be able to answer both questions comprehensively, but I will share some thoughts. I think what probably many of our audience is aware of here, but which is not, but I think which is not so clear across health professionals in general who are not so engaged with the topic of climate change, environmental changes, and planetary health yet, is this great potential that we have such a voice. You know, it's health professions. I think that will differ from country to country, but at least I know it from Germany. Are health professions, so not only doctors but also nurses and other health professionals, one of the most trusted professions. And so this on the one hand, and on the other hand, I think we as health professionals also have the responsibility to advocate for the protection of people from these health risks from environmental changes. For example, another example from Germany, in the regulation which is describing the doctor's profession, it is explicitly mentioned that the protection of the natural foundations of life is a task of doctors, which is interesting that it's already included there.
Probably no one knows, or the majority doesn't.
Yeah, the majority doesn't know. And what I feel when I'm giving a lot of courses also to medical students, but also public health students, and I sense that the awareness is definitely rising. And many people are now asking themselves, what concretely can I do? Because it all seems such a big task, and I'm only one person. But if we really network with other people, I mean, we already talked about it last time. For example, the Planetary Health Alliance is a global network where you can engage and where you can connect and network. If we really network and join forces and exchange about stories of success, I think that's very important parts of becoming change agents. To not try to do that alone, because that's not possible. We all can do a lot, but I think if we work together, we can do a lot more. And regarding your other question, that's also partly maybe a question to Hashim as well from my side. When I was presenting these different options of action, which are conceivable in health systems, which were lined out in the new report of the German Advisory Council on Global Change, I think it became clear when I talked about that this is kind of a vision. This is kind of ideal possibilities that we could do if there are sufficient resources, for example, and if there is enough policy support, and if there is, for example, sufficient basic healthcare in general, which allows us to take further steps and, for example, integrate lifestyle interventions which aim at sustainable and healthy behavior at the same time, to have capacities to do that and put a stronger focus on things like that. So I think that strongly varies across different countries how feasible it is to take all these actions. So I'm wondering what were your thoughts about these fields of action and the different options that I was presenting. Do you see that feasible in health systems in Africa? I would be very interested in your thoughts about that.
So I think that it is feasible. I may be wrong, but I think that it is feasible, but under some specific conditions. So it is feasible in a context where awareness is raised, because from this side of the planet, except the elite and maybe some farmers that have direct impact on their crops production, on reliability of the seasons, no one is talking about it. We are in Africa, it's normal to have heat, it's normal we have been having flood for decades, even if it's intensifying now, we do not measure it at the lay person level. So raising awareness to make the connection between what we are going through on daily basis and the climate change as its root cause, as one of the main root causes. Second is to talk to people, to approach them not as consumer of the strategies, but to see, because they have alternative knowledge. They have a lot of knowledge that for me do not make sense. But whatever we are saying, they are there and they are surviving conditions that I could not survive. So they have their self-resilience, and we need to understand maybe much more their resilience, how they do to survive in conditions where me here as someone that is, has a certain professional and socioeconomic level cannot live in. So those are, for me, I know that is not a full picture of the whole conditions that that need to be gathered, but for me, from my perspective, those conditions are key to go about those challenges and those solutions. What do you think about it? Sorry, we are hijacking Sabine.
That's okay. I mean,
Thank you.
that's exactly what we want. We want you guys share your thoughts, and maybe Jennifer also has some thoughts to share on that.
Yeah, I really just pick up on what Oskar said about healthcare workers being most trusted, because I think that's a really important point. And I think that's something we see again and again in studies coming out from across the world. If you ask members of the public who do they trust most, healthcare workers are always at the top of that list. And that's right down from doctors right down to community healthcare workers. And so I think actually being able to influence communities is important. And I think also at the same time, those people being able to influence policy, because healthcare workers are also at the sharp end of seeing the first impacts of climate change. And we also know that health is a really strong policy driver at the national level. So if healthcare workers are noticing and recording early impacts of climate change, and an example that I might give, that one of the ones I picked up on is, the increasing cases of dengue that we're seeing. We know dengue is changing, cases and prevalence of dengue is changing in a lot of areas of the world because of climate change. If hospitals can be recording that change and feeding that up to policymakers as quickly as possible, while also influencing the community to perhaps look at some of the ways they can reduce dengue prevalence. And, we know things like just, uncovered water, barrels of water in back gardens, potholes in the road where mosquitoes can breed. These are quite small things. I know when we were in Tanzania in the summer, they were talking about cutting back bushes and getting communities to kind of cut back some of the bushes where vectors tended to live. They can influence it on both levels. And so I think they are embedded. Healthcare workers are embedded in the community in a way that few other sectors are. And also virtually everybody interacts with the healthcare sector at some point or another during the year. And so there is that real opportunity to influence in both ways. And some of the ways, for instance, that the NHS is influencing is just now, most NHS hospitals don't serve red meat anymore. That was never kind of advertised. It was never made obvious. Most people wouldn't even notice it. But it may just give people that opportunity to have a different meal they wouldn't normally have. And then perhaps when they go home, they think, oh, I quite liked that. Perhaps I'll have it again. And so kind of little bits of influencing like that, I think the healthcare sector can have a huge influence in. Just generally, again, in the UK is now doing a lot of green prescribing. So, for instance, walking groups, doctors will suggest to people, particularly for kind of low-level mental health, it happens a lot with elderly people who've suffered a bereavement, particularly bereavement of their partner. They'll be suggested by their doctor that they join a local walking group and go out for a walk on a Sunday. or go for a group that goes for a walk in the park every so often. And that, again, starts to show the real value of green space. I think a lot of that influencing comes from evidence bases. And I think it was absolutely true what you were saying about the kind of the lack of investment. One thing we've really been seeing is a real vicious cycle, particularly in Kenya and Tanzania, when we've been working with, is there's no money for research, but without the research, you can't evidence what you need, and you can't bid for what you need if you haven't evidenced a need for it. And so we have that vicious circle between, without that investment, you can't get there. And I think that's actually really important. What are the small wins, the small gains that you can get just to evidence something that might be able to provide the baseline for the investment for the next research project that takes it to the next level? And that research planning cycle, I think, is really important, looking at what can you do with what you've got that will help you to evidence the next step of where you want to get to next, and drive the investment to allow that next step to happen. And I think that's something really that the Planetary Health Alliance and the international partnerships can really help with, kind of showing how that research process and research cycle can work, and where are the best places to focus to drive the investment that you need to get to the next stage.
You were like perfectly leading over to my next question, Jennifer, and already answered it. What kind of role research, and particularly research collaboration between Europe and Africa, or different regions, can really play? And I think you gave a perfect answer to that already. So thanks to that. As we are already coming to the end, I think we leave it to that for today. Thanks to all our panelists for your presentations, sharing your knowledge, your insights, also personal opinions. It is very much appreciated. Maybe just before we close, a few announcements. Next week, we will continue with the webinar series. The next session will focus on economical opportunities for people and planet. I'm very curious about that. Coming from a medical background, this is like an unusual terrain for me. So I think I will have a lot to learn as well. But as we have and want to learn across disciplines and sector, I think it is really essential to leave our comfort zones and look into other aspects within that big picture of planetary health. Eva Maria, was there anything you wanted to say? I think you had planned to maybe show us an overview of the next sessions, but this is also fine. I think we leave it to this. Thank you very much to everyone. And I hope to see you all next week.